What I learned in the emergency room, part 2. Last week I discussed my recent trips to the emergency room due to severe pain in my left abdomen. One minute I was happily watching the Netflix series The Queen's Gambit, and the next minute I was rushing myself to the emergency room. Upon arrival, I ended up seeing a number of different nurses, doctors, and specialists to help diagnose the issue. I also had blood tests, urine tests, and x-rays that all came back negative. The only thing they found was some fecal buildup in my colon. Nothing serious, not a blockage, just some buildup that could trap gas and cause constipation and be extremely painful. Like I mentioned last week, I became extremely skeptical of this diagnosis as I exercise regularly, eat tons of fiber, don't take any medications, and wasn't dealing with any sort of stress. Despite raising my concerns to the hospital staff, they couldn't find anything that would have caused it. But that was until they decided to take a second set of x-rays and have a second look. This time with a new set of x-rays and a second set of eyes, they ended up identifying a small stone in my left ureter, a kidney stone. And kidney stones are known to be extremely painful as they're essentially a spiky rock that runs through a tiny tube in your body. And so this made a little more sense to me how it could be so painful. But still, I was kind of confused. I mean, usually kidney stones happen to people who consume alcohol, meat, high sodium diets, or various medications. And to which I took none of those. I even mentioned that to the doctors, but they seemed just as skeptical of my answers. I mean, how many people my age don't consume alcohol, medications, meat, or a high sodium diet? Few people. But I was one of them. Eventually, the stone passed, the pain disappeared, and the doctors were never quite sure what caused the issue. Throughout the experience, I saw how easy a misdiagnosis can happen. I also started to learn that I was a key player in identifying the issue, finding the cause, and putting a prevention strategy in place. And by the end of it, I think I found out how a person as healthy as me got a kidney stone. Let's get into it. The emergency room is a fast-paced environment where nurses and doctors don't always have a lot of time for their patients. On top of this, there's numerous shift changes between hospital staff and information exchanges between nurses and doctors. Despite everyone's best efforts, communication breakdowns are bound to happen. We're all human, and it's not easy to just brain dump all the information you've learned about a patient to your replacement colleague. And lastly, a nurse, a doctor, or a specialist are all going to have their own specific questions that they ask you. Some of these may overlap, but some of them might be the same, and they're all just trying to put together a complete picture of your health and your situation to help diagnose the issue. But this can be difficult too, because they only get the information you give them, and they don't have time to hear your entire life story. Obviously, you can see how these factors play a significant role in misdiagnosing a patient's issue. That's why about 10% of all diagnoses in the United States are incorrect, which account for about 12 million misdiagnosed issues per year. On top of that, women and minorities have a 20 to 30% increased chance of receiving a misdiagnosis. Because of this, a second opinion can prove helpful. 88% of the time, when people go seek a second opinion, they receive a refined or changed diagnosis. But it's not always that the doctor giving a second opinion is smarter than the doctor who gave the first opinion. A lot of the time, it's because you're more knowledgeable on the topic, and you're able to better convey that message to the second opinion doctor. You've already been through the process once, and you're able to communicate the complete picture in a more effective manner to that second opinion. And that brings me to one of my two main points. You are the best person to help solve your own issue. You have all the information and experiences. You know your habits, lifestyle, and history. You know of any allergies you've had or medications you've taken. Everyone else is just trying to tease this information out of you to help solve the problem. But the key here is that you're the source of all the information. And that's why I believe you should start thinking of yourself as a leader, where doctors, nurses, nurse practitioners, and specialists are all extremely helpful and knowledgeable team members trying to help you solve your issue. On top of that, you can think of tests, scans, and examinations as tools to help you solve the issue. But the key here is you're an active player in help finding the issue, correcting it, and preventing it from happening again in the future. So here are a few tips I recommend for this process. Keep a precise log of all your symptoms with time and date stamps attached. Create a list of all the tests you've had and professional opinions you've received. Research the issue yourself, not to self-diagnose, but to be more aware of the possibilities. Ask your doctor, what information can you provide or tests can you take to determine the issue? Ask them if there's a specialist or second opinion doctor they'd recommend you see. And once diagnosed, ask them what you can do to help prevent the issue again in the future. My second main point is that living a healthy lifestyle makes the whole process easier. When asked about drugs, marijuana, alcohol, or smoking, I could easily say no and rule out any of those possibilities. When asked about stress or issues at home, I didn't have any of those either. I also had an optimal body weight, blood pressure, heart rate, and cholesterol, so any of those things could be ruled out too. I also don't have any underlying diseases and limit my consumption of processed and salty food. So when it came time to start narrowing down the list of possibilities of what caused my kidney stones, it made it much easier. So here's a list of risk factors for kidney stones I found on Dr. Joel Fuhrman's website. Let's go through it. Chronic diseases like diabetes, obesity, gout, or hyperthyroidism, I didn't have any of those. Dysbiosis or imbalance of a healthy gut flora, Not me either. Poor nutrition, high in animal protein and sodium, low in calcium and magnesium? Not me. High oxalate consumption found in spinach, Swiss chard, rhubarb, beet tops, chocolate, and tea? Possibly. High fructose consumption? Not me. Vitamin C and calcium supplementation? Not me. Low fluid intake? That could be it. Increased alcohol intake? Not me. Medications like diuretics, antivirals, and anti-seizure? Also not me. And here's where I identified the top 2 causes. Low fluid intake has always been a problem for me. Someone once purchased me a flashing light that attaches to a water bottle and reminds you to drink every 30 minutes. Coincidentally, the battery died about 6 months ago, and I haven't replaced it. Second, through some more research, I found out that spinach, Swiss chard, and beet tops have about 100 times more oxalates than any other green like kale or spinach. And if you eat 2 or more cups of those specific greens every single day for an extended period of time, you can get kidney stones. And surprisingly, I was eating 3 to 4 cups of spinach and Swiss chard between my salads and smoothie bowls every single day. It's hard to give yourself kidney stones on a whole food plant-based diet. Most of the time, it prevents it. The exception to this rule are high oxalate foods, with spinach, Swiss chard, and beet tops being the worst culprits. So now I need to replace the battery in my water bottle reminder and start diversifying my greens intake. But it certainly helped living a healthy lifestyle. As an example, there was an elderly person next to me at the emergency room who had been admitted for blacking out and falling. I could overhear their conversations, and he had been smoking marijuana and drinking alcohol. On top of that, he had high blood pressure, high cholesterol, type 2 diabetes, consumed an unhealthy diet, and was overweight. There's so many various factors that could have caused his blackout that the doctors couldn't pinpoint the issue. Was it alcohol consumption? Marijuana and alcohol consumption? Was it a low blood sugar from his diabetes? Was it a combination of everything? Who knows? So here are my final thoughts. The emergency room is a fast-paced environment with frequent shift changes that can cause communication breakdowns. This, in combination with time limitations and their limited view of your health, makes misdiagnosing an issue very possible. The good thing is, you can help in diagnosing your issue and helping prevent it from happening again in the future. Keep a list of your symptoms with time and date stamps attached. Ask your doctor good questions, and do some of your own research. Lastly, make the whole process easier by living a healthy lifestyle. Doing this allowed me to help diagnose my issue easier and put a plan in place for preventing it again in the future. A plan that's going to allow me to live healthier and happier. And if you're curious about The Queen's Gambit, I did end up finishing the series, and it's a great Netflix series that I recommend you watch. It sparked my interest in chess, so obviously I went home, crushed my brother in chess a few times. He may have beaten me once or cheated, not exactly sure, but it's a great show that I recommend you check out. Thanks for watching to the end of the video. If you like this video, please enable the like button. If you have any questions, drop them in the comments below. And if you want to see more content like this again in the future, please subscribe to my YouTube channel. Lastly, if you're looking to take your health and fitness to the next level, take a look at My Health Sciences Plus. This has all the exercises, exercise programs, meals, and meal plans I use to get and stay in the best shape of my life. Thanks again for watching, and I look forward to talking with you guys again next week.